This video was created to review the options, risks, and uncertainties associated with arm tucks or brachioplasties. Please follow along with your written consent forms and be sure to write down any questions as you go so that we can be sure to give you all the information you need to be able to make an informed decision regarding whether or not to proceed with surgery. General information. Brachioplasty, or arm lift, is a surgical procedure that is used to help remove excess skin and fat tissue from both axilla and upper arm. Brachioplasty is not a surgical treatment for being overweight. Obese individuals who intend to lose weight should postpone all forms of body contouring surgeries until they have reached a stable weight. There are different techniques used by plastic surgeons for brachioplasty. Brachioplasty can be combined with other forms of body contouring surgeries, including liposuction or other elective surgeries. Alternative treatments. Brachioplasty is an elective surgical operation. Alternative forms of management include not treating the areas of loose skin and fat deposits with other surgery. Liposuction with other skin tightening technologies may be a surgical alternative to brachioplasty if there's good skin tone and localized fat deposits in an individual of normal weight. Diet and exercise regimens may be of benefit for overall reduction of excess body fat. Risk and potential complications are also associated with alternative forms of treatment. Inherent risk of brachioplasty surgery. All surgical procedures involve a certain level of risk, and it's important that you understand these possible risks and the possible complications associated with them. In addition, every procedure has its limitations. An individual's choice to undergo a surgical procedure is based on the risk to benefit comparison of the procedure. Although the majority of patients do not experience any of these complications, you should discuss them with me if you would like more clarification to make sure you understand all possible consequences of brachioplasty. Specific risks of brachioplasty surgery. Change in sensation. It's common to experience loss of skin sensation in areas that have had the surgery, such as the upper arms or armpit. It is rare to experience permanent changes in sensation in the hands and forearms after brachioplasty, but it is possible. Diminished or complete loss of skin sensation may not totally resolve after brachioplasty. There's a small risk of motor nerve injury, which may result in impairment of upper extremity or hand function. Skin discoloration or swelling. Bruising and swelling occur commonly after brachioplasty. The skin in or near the surgical site can appear either lighter or darker than surrounding skin. Although uncommon, swelling, including the forearms and hands, and skin discoloration may persist for long periods of time, and in rare instances may be permanent. Sensation of arm tightness. After tucking the arm skin, there can be a tight sensation in the arm and/or armpit area. There could potentially lead to the loss of range of motion of the shoulder. This usually subsides over time. Additional surgery may be required to correct this problem. Pain. You will experience some pain after your surgery. Pain of varying intensity and duration may occur and persist after brachioplasty surgery. Chronic pain may occur very infrequently from nerves becoming trapped in the scar tissue or due to decreased mobility of scarred skin. Delayed healing. Wound disruption or delayed wound healing is possible. Some areas of skin may die or slough off. This may require frequent dressing changes or other surgeries to remove the non-healed tissues. Individuals who have decreased blood supply to the tissue from past surgeries or radiation therapies may be at increased risk for wound healing and poor surgical outcomes. Smokers have a greater risk of skin loss and wound healing complications. Scars. All surgeries leave scars, some more visible than others. Although good wound healing after a surgical procedure is expected, this surgery will result in long, prominent scars that are permanent. Abnormal scarring may occur within the skin and deeper tissues. Scars may be unattractive and may be of different color than the surrounding skin. Scar appearance may also vary with the same scar. Scars may be asymmetrical. There is a possibility of visible marks in the skin from sutures. These scars may become raised, red, or discolored in the first few weeks or months, but usually settle down over time. However, some patients are prone to hypertrophic or keloid scars, that is, prominent raised red scars that do not settle. Further treatments with medications and/or surgeries may be required. Seroma, fluid collection. Though infrequently, fluid may accumulate between the skin and the underlying tissues following surgery, trauma, or vigorous exercises. Should this problem occur, it may require additional procedures for drainage of the fluid. To help prevent this, surgical drains are oftentimes used. Use of drains. During your surgery, I may find it necessary to place drains. A drain is a small, soft rubber tube that drains fluid out from the area that was operated on. You will be instructed on the use of your drain. Placement of the drain may require a small separate incision. The drain will be removed in my office when I feel it is no longer necessary. I typically do not close the drain site. Rather, I leave the site open to drain any residual fluid under the wound and minimize the risk of the drain site getting infected. Reloosening of skin. Almost all patients have this procedure will notice reloosening of the skin over time. This occurs due to the body's inherent response to stretch. Patients who have lost massive amounts of weight are prone to this phenomenon. No matter how tight I make your skin at the time of surgery, it will reloosen to a certain degree with time as the swelling subsides. Each person's skin loosens to a different degree. Asymmetry. Symmetrical body appearance may not result after surgery. Factors such as skin tone, fat deposits, skeletal prominence, and muscle tone may contribute to normal asymmetry in body features. Most patients have differences between the right and left sides of their bodies before any surgery is performed. Additional surgeries may be necessary to attempt to diminish asymmetry. Persistent swelling, lymphedema. Persistent swelling can occur following surgery. If you haven't already, please watch the video that discusses the general risks of surgery and recovery. We will now discuss brachioplasty discharge instructions. Wound and drain care. You may remove your dressings and shower after 24 hours unless advised otherwise. Have someone with you when you take a shower for the first time after surgery. Sometimes patients get lightheaded the first time they shower, so to be sure, there's a place for you to sit if that should occur. Do not apply ice, a heating pad, or hot water bottles to your arms. Due to gravity, it is not uncommon to develop swelling and some bruising the first few days after surgery. This will resolve on its own. You may have 1 or 2 drains that will be removed by a nurse in the office. If you have drains, empty them twice a day, every 12 hours. Record the output and recharge the bulb by squeezing it so that it will maintain suction. This drain output information will be provided to the nurse to determine when to remove your drains. Please call the office to schedule an appointment to have your drains removed. Remember to bring your drain sheet to every post-op appointment. Leave the skin glue or Steri-Strips in place for up to 2 weeks. If a rash or blisters develop, gently remove the Steri-Strips or skin glue. Scar care products will be used after the Steri-Strips or skin glue are removed. Most of the sutures are absorbable and will dissolve within 6 to 12 months. Call me if you experience persistent or increasing pain not relieved by pain medications or if you have a fever over 101 degrees Fahrenheit. Call 911 immediately or go to your local emergency room if you experience shortness of breath, sudden sharp chest pain, especially if made worse by deep breathing or coughing, painful respiration, a new onset of wheezing without any prior history, or if you experience a seizure without any prior history. I hope this information has been helpful, but feel free to let us know if you should need any other information and want more clarification on any of these issues. We look forward to helping you achieve your desired appearance. Thank you.